In this video, I'll be performing ostomy pouch care and replacement. To start, I'll go ahead and verify my physician's orders to change the pouch and the skin barrier. Once I've done that, I'll identify my patient using two identifiers such as their name and their date of birth. At that point, I'll perform hand hygiene and go ahead and don a clean pair of gloves. I have all of my supplies ready. I have a new pouch and a new skin barrier, as well as a container to measure the output from the bag, my scissors to cut the new stoma barrier, and a measurement tool to approximate the edges, as well as a basin of water and a washcloth. So now that I have my clean gloves, I'll go ahead and empty the pouch into this basin, and my output is about 250 milliliters. And now I can go ahead and remove the pouch and place it into a biohazard bag, and then I'll remove the former skin barrier and I'll place it into the bag as well. Now I can go ahead and take a wet rag and clean the area around the stoma so that I can visualize it well. I'll make sure to get all of the residue and buildup away from around the stoma. And then I'm just going to take a moment to assess the stoma itself and include the appearance. Make sure that it's not dusky or strangulated. You want it to be red to show that it has good blood flow, and that it also doesn't have any evidence of skin breakdown around the stoma itself. I'll then go ahead and take a dry rag and pat dry around the area of the stoma. And then I'm going to discard my soil gloves, perform hand hygiene, and don a new pair of clean gloves for the stoma replacement. It's important to approximate the edges of your stoma so that you can cut your barrier to be just big enough to fit over the stoma without allowing fluids to leak around it. So I would take my measuring tool and measure the stoma, and it's about 3 centimeters wide and about 4.5 centimeters long. And then I would take my new barrier and cut the opening to be approximately that size. Remove the adhesive backing, and then place the new barrier over the stoma, ensuring that it's a tight fit to allow nothing to leak around it, and to also make sure that it isn't too small and will strangulate the stoma. I'm then going to put my new ostomy pouch over the new barrier and press firmly to make sure that it fits securely and doesn't allow anything to leak out around the edges. Then I'll ensure that it's closed. I'll remove my gloves and perform hand hygiene once again. And then I'll document how the patient tolerated the procedure, as well as the output from the stoma and the appearance of the stoma.